Hi, I'm Mirza Adnan Beg. I'm Division Head for Geriatrics, Department of Family Medicine, Henry Ford Hospital, Detroit, Michigan. So today's topic is urinary incontinence and hydration practice in skilled nursing facilities. So we're going to be talking about how to recognize evidence-based practices to improve resident incontinence care planning and hydration in long-term care facilities. So what is urinary incontinence? What's the definition? It's loss of bladder control due to bladder muscle contractions, weak pelvic floor and/or sphincter muscles, blockage in the urethral opening. There are different causes for urinary incontinence. The common causes are tumor, cancer, diabetes, neurological disorders like strokes or some other disorders like ALS, physical changes associated with aging, and there's one thing called functional incontinence, which is because the person is so weak and lacks physical strength to get to the bathroom in time. The urinary incontinence is twice as common in women as men. 43.8% of surveyed adults aged 65 and older in the general population reported urinary leakage. Among the nursing home facilities, it's reported to be 36.7% in short-term residents and 79.3% in long-term residents. So all of you who work in long-term care facilities must be aware of FTEC 315, which relates to urinary incontinence. It reads as, based on the resident's comprehensive assessment, the facility must ensure that 1. A resident who enters the facility without an indwelling catheter is not catheterized unless the resident's clinical condition demonstrates that catheterization was necessary. 2. A resident who is incontinent of bladder receives appropriate treatment and services to prevent urinary tract infections and to restore as much normal bladder function as possible. As you must all know that now there's 5-star rating, and this is one of the things which has high score and can affect the 5-star rating for the nursing homes. Remember the I in CAUTI. So CAUTI is catheter-associated urinary tract infections, and the I stands for incontinence care planning. C is for catheter removal, A is for aseptic insertion, U is for use regular assessments, T is training for catheter care, and I incontinence care planning. So it's a very important part of patient care in preventing urinary tract infections and keeping a person continent. Voiding strategies. So there are 3 main voiding strategies: prompted voiding, habit training, and timed voiding. So other strategies which can help in the urinary incontinence planning are medications. A lot of times physicians prescribe medications to help with urinary incontinence, but they can actually cause more harm. For example, commonly prescribed medicine is oxybutynin. The other name is Ditropan. The doctors or the healthcare providers prescribe it for urinary incontinence, but in people who have neurogenic bladders or people who have problem with holding in urine, these medications actually can cause more retention of urine and result in overflow incontinence and more side effects. So it's very, very important that we always weigh benefits and risks before we start a medication. Commonly used are absorbent pads, which are commonly used in nursing homes, primarily long-term care, to help with incontinence. Actually, they should not be used as a long-term solution for urinary incontinence. They can impact a resident's dignity, they can cause skin irritation, can cause skin breakdown, and over the time, it can be costly for the facilities. Dehydration, as you all know who work in long-term care facilities, is an important problem and a common phenomena in elderly patients, and the nursing home staff is trained not to use this word. So what is dehydration? Dehydration is the abnormal loss of body fluids. It can be caused by increased fluid loss or decreased fluid intake. Common examples of increased fluid loss are illness, medications like diuretics, and sometimes the environment. If there's too hot or the fluids are not available, it can result in increased fluid loss. Decreased fluid intake, examples are decreased thirst perception. So decreased thirst perception is actually very common in elderly patients. Inability to obtain fluids, so they don't have access to the water or the liquids. Difficulty with swallowing, so they cannot drink enough. Intentional decrease of fluids due to incontinence. So some of the elderly patients just avoid drinking fluids because they worry about incontinence or leakage. And sometimes they are on fluid restrictions, as people with congestive heart failure and renal disease, and they don't even receive what they're supposed to. The common signs and symptoms of dehydration are decreased urine output, change in urine color and smell, low blood pressure and or high heart rate, mental status changes, dry, sticky mouth, weak, or feeling of tired. Next question is, how can we prevent dehydration in our resident population? So some of the ways which can help to prevent dehydration are involve the dietary and nutrition teams, so that they can come up with modalities where they can encourage fluids for the residents in the long-term care facilities, or make the availability of fluids easy. Provide foods high in water content. For example, watermelon or cantaloupe is one of the examples. Provide liquids before and with meals. Provide liquids between meals and with medication passes. Encourage each resident to drink fluids and offer fluid preferences. Develop targeted care plans to prevent dehydration and rehydrate. Ensure good mouth care. Track and review fluid intake. Hydration is very important. Now I'm going to talk about some myths regarding urinary tract infection, which are very commonly prevalent in staff at the long-term care facilities. You must all have heard this or gone through it yourself. My resident isn't acting normally. It's probably UTI. So it's just a common practice that our doctor will be called and say, hey doc, Miss Ford is acting out. She's confused. I think she has a UTI. Let's get a UA. So there are other reasons for change in mental status too. And one of the common reasons for mental status changes in nursing home patients is dehydration. They could also be a little bit more confused than their baseline because they're just more tired. It could be due to some new medication or a side effect of existing medications. Could be from vascular problems, injury to head, just a little bit of acting out or behavior issue associated with dementia or sundowning, which is common, hearing or other sensory deficiencies. Infection can also result, but there are many other causes for mental status changes. Please remember that mental status can be related to an infection. It does not necessarily mean that someone has a UTI. It's always better to wait and assess the resident frequently for other symptoms of infection. So to get the vital signs, you can monitor, see if the patient is getting worse, make sure patient is eating okay, there's no new change in his appetite, there's no new decline in function, just the condition continues to get worse. We're also going to talk about some signs, symptoms of infection. So other myths about a person having urinary tract infection is strong or foul odor to urine, or urine looks too dark. So there are other reasons for which urine can smell foul. The smell of urine has to do with the amount and concentration of substances that are excreted by the kidneys. Urine that is more concentrated may smell more like ammonia. Some of the common reasons for which urine can smell foul is dehydration, certain health conditions, certain foods and vitamins can also affect the smell of urine. The color of urine comes from a pigment called urochrome. If urine is darker, then it is more concentrated. This may indicate that a person is dehydrated and needs additional fluids. Now, we have got a UA and it has some positive findings. So what we'll talk about, what are the other reasons for positive results of a urine analysis beside infection? So one of the common reasons is contamination. So as you all know that it's not easy to get a clean catch or midstream catch urine specimen, especially among persons who may have cognitive issues or mobility problems. Many residents will have bacteria in their urinary tract, not causing infection, especially residents with catheters or who have had catheters in the preceding weeks. This is called colonization. Antibiotic treatment isn't usually recommended unless there are signs and symptoms of active infection. And obviously the third cause is actual infection will also result in positive findings. Remember, bacteria in the urine does not mean that there is an infection if the resident shows no other signs or symptoms of a UTI. Conclusions, very important to make sure that patient is hydrated. So it's very important that we come up with effective implementation of strategies to promote hydration among the long-term care residents as well as subacute care residents. Effective implementation of strategies to promote incontinence care planning. Awareness of true signs and symptoms of UTI. And we should all be aware and be cognizant of myths related to UTI as we discussed. Thank you.